And local hospitals are dealing with a lot of changes as they try to combat this pandemic. We're joined now live by Dr. Michael LeFevre from MU Healthcare. And Doctor, thank you so much for being on with us this morning.
Absolutely, my pleasure.
And I wanted to circle back. We were talking a lot about telemedicine and telehealth, essentially. So those primary care doctors can kind of all of a sudden offer these video services. Why is that they can offer them now, but maybe we didn't see as much of a push for them in the past?
Well, the telemedicine that we're providing right now through video visits was not possible under the regulatory environment just a couple of months ago. So in response to the pandemic, the federal regulatory environment loosened their regulations and allowed us to provide this type of care. We're excited. We've been wanting to do this for quite some time and quite honestly expect to be able to continue to do it in the future.
Okay, yeah, I was going to ask, do you see this kind of impacting the way doctors are seeing patients after this pandemic subsides?
Yeah, I like to say that they're not going to put this genie back in the bottle, and I think that both providers and patients are going to become accustomed to this type of service, and quite honestly, it's both effective and cost-effective and convenient, and I think that we're going to be continuing to incorporate this type of care into practice into the future.
And are these video visits something that's covered by insurance for people, maybe watching this wondering?
Yes, video visits are covered by insurance, and that's another one of the changes that has been made. They relaxed those requirements as well so that we can do it in a cost-effective manner.
And what do you have to say for patients who may be putting off some appointments over fears related to COVID-19?
My advice is don't let the pandemic keep you from getting necessary health care. Your health is our priority, and we're making every effort to be able to provide that care on an ongoing basis in spite of what's going on around us. And it's safe, and it can be done effectively.
And so how does someone know when it's okay that they can maybe put off a screening or an appointment?
Well, there certainly are some services which can be put off safely for 2 to 3 months, and certainly some screenings fall into that category. If you feel well and you have no ongoing health concerns, and, for example, just need a pap smear, I think it's fine to put off that pap smear for 2 or 3 months. Similarly, we're not doing screening mammography right now or screening colonoscopy for colon cancer. So there are certainly some things that we're delaying, but probably not for more than 2 to 3 months.
Okay. And now switching gears a little bit, do you feel that MU Healthcare is prepared for a potential surge of patients because of COVID-19?
I'm sorry, I missed that question, but MU Healthcare is certainly prepared to continue to provide the care that people need.
Okay, so I know we kind of have been hearing from national numbers that there is a potential peak coming for Missouri later on this month, I think in exactly 13 days. Is that what MU Healthcare is seeing as well?
Well, MU Healthcare is absolutely prepared to deal with any type of surge in cases in central Missouri. And we're watching the same numbers that you are, and hopefully we will peak out here in the next couple of weeks and things will get better. And if things don't get any worse than they are now, we can be grateful that we live in central Missouri.
Absolutely. All right, Doctor, thank you so much for being with us this morning. We do appreciate your time. I know it is very busy right now.
It's been my pleasure.
All right, well, we'll now see your stories when we come back.